Good afternoon, ladies and gentlemen. Welcome to the Navigating the New Realities of Care Delivery with TELUS PS Suite webinar. I am pleased to introduce today's speaker, Teresa Storer. Please go ahead.
Thank you and welcome everyone. My name is Teresa Storer and I am the Implementations Director at TELUS Health. I've been with the organization for just a little over 20 years and I've had a variety of different roles, all primarily working with our clients and supporting them through some form of their implementation, whether that be through learning, project management, and data activities. Today, I support a team of individuals that walk you through your implementation and support you until you are live. So with that, we're going to get started, and we're going to cover a few housekeeping items before we turn it over to my colleague. We're delighted to have you with us today, and we hope you enjoy this presentation. For better sound quality, we recommend that you connect to the webinar via the telephone number that was provided in your registration confirmation. This will also allow you to ask questions directly to the speaker at the end of our webinar. Your audio is currently muted by default. The webinar is being recorded and a link of the recording will be sent to you in the next few days. Your feedback is important to us. It helps us improve our webinars. It addresses topics that are important to you. And as such, we will invite you to complete a short satisfaction survey that will appear after the webinar. By completing the survey, you'll be entered in to win a draw of a $300 Amazon gift card. Please know that your responses are confidential, and we ask that you fill in the contact card at the end of the survey to be eligible. You may have noticed that our webcams are activated, and to change the location of the webcam, hover your mouse over the square icon at the top right corner of your screen, which is currently presented. You will be presented with three options. We recommend clicking on the side-by-side option for optimal webinar viewing. If you have a question during the webinar, please post it to the Q&A tool. You can access it from the three dotted icon located at the bottom of the screen. Type your question, select to all panelists, and press submit. We'll try to respond to these during or at the end of the presentation period, at a time when the audio will be open for you to ask questions live as well. Please note that we will also be opening the phone lines at the conclusion to provide you with an opportunity to ask those questions live. Now let's have a look at today's agenda. My colleague, Alison Foster, will do a live demonstration of PS Suite so you can see how the solution can help you be more efficient, flexible, and responsive so that you can have more time to focus on your patients. The webinar today will focus on PS Suite EMR demonstration, communications with patients, pharmacists, and other providers, access to your EMR from your mobile device, implementation processes, and a question period. Without further ado, I'll turn it over to my colleague and introduce Alison Foster. Please go ahead.
Thanks, Teresa. Yeah, so again, I'm Alison. I'll spend 1 minute at max introducing myself to you to know who I am. So I've been with TELUS for a little over 6 years now, just hit 6. So I've been working with a number of our clients in a kind of a variety of different roles. So started as a trainer, then went into kind of working with existing clients. Now I'm kind of working with all of our prospective clients to find custom solutions for their clinics. So always been working with a product to find out how our PS Suite can work well with your needs and your requirements for your busy clinics. So happy to be here today and happy to show you a demo of PS Suite. So I'll be walking you through, again, a number of our different tools and services that allow you to, again, customize your EMR for your needs. So to give a little kind of introduction of why we're hosting this webinar. So COVID has definitely changed the way we practice medicine. So when that kind of hit in March, virtual care turned into like a daily reality. We can no longer have patients inside of our clinic. So we had to adapt workflows pretty quickly, or you had to adapt workflows really quickly. And TELUS recognized that lots of things would change in your clinic. And if we wanted to be successful in supporting our clients, we had to embed the remote healthcare directly into existing workflows. So we want to have it integrated directly into your EMR without requiring just extra steps. So no different logins, no different portals, no different registration processes. We knew that, again, to support you and your virtual care, we had to make sure it was all seamless in one screen. So throughout today, I'm going to be showing you how we've kind of accomplished that. And I'm going to be using Teresa as kind of a dummy patient to walk you through a potential encounter that shows you communication with patients, which will be Teresa, communication with pharmacies, communication with other providers, all from our EMR without having to go to a different window. So again, some of these tools, I'll come back to the PowerPoint and kind of walk you through some of the functionality we have. Most of the day I'll be spending it in PS Suite, so you can actually see how you'll interact with the software on a daily basis. So again, my goal is to give you kind of an impression of how you'll be using the software through a regular encounter, a regular virtual encounter, which is kind of our daily reality now. So before we get started in the demo encounter with Teresa, I am going to walk you through some of the main PS Suite screen. So kind of give you a quick tour just so you know exactly what we're looking at, just so you can kind of situate yourself in the demo and see how we can customize it for these virtual encounter windows. So I'm going to jump right into the overview. So here is, again, PS Suite. This is what the clinicians will see on a daily basis when they're working inside of their clinic. So at the end of the presentation, actually at the end of the demo, I'm going to show you how the exact same workflows can be conducted through our mobile app as well. So you're going to have this PS Suite, so like the desktop skin, and we also have a whole other interface that you can use to accommodate these workflows from your cell phone, from your tablet, through our EMR Mobile, which is complementary to all of our users. So we call this the main dashboard. So this is how you get into different areas of the program. So your appointments, that'll be all of your appointments for your providers in your clinic, our patient demographics, our billing files. We have our address book, which is external communication sources. I'll cover that more with MedDialog and PrescribeIT as well. We have our handouts, which is our repository of maybe your education sheets, maybe your back pain exercises you want to provide to your patients. That can all be stored in handouts. Messages, which is your external and internal task list. So everything is kind of one-stop shopping in PS Suite. Again, I'll cover that more later on the demo. And finally, our records window, which is where all of our medical charts are stored. So this is standard across all of our users. One common thread you'll see with PS Suite is everything can be customized for a specific user. So we have a dashboard here that allows me to, again, add these different tools or widgets to my main toolbar to customize it for my needs. So as a physician user or as a nurse practitioner user, I might want to add my labs to this window. If I'm an administrator, I might want to add my coverage to this window to see who's on vacation, to see who's covering for which users. This is all customized per user, just again to make sure that the EMR meets your needs for what you're looking for throughout your daily tasks. So again, one of the first things you'll see throughout the presentation is how we can customize PS Suite on almost every screen to make sure it's more applicable for your role or for your users. The other thing you'll see is that we want to make sure that everything in PS Suite is really intuitive and easy to use. So whether it's going from your patient file, which is our demographic window, back to seeing their appointments, everything's always going to be a click away or a keyboard shortcut away. So again, to get from demographics to the records, get from their demographics to appointment schedule, everything's going to be, again, shortcut, keyboard shortcut or mouse click. Other things to notice about how PS Suite can be easy to use is we actually can have multiple windows open at one time. So I could have my demographics open to answer phone calls, to take messages, and I could also have my appointment schedule open on the left-hand side of my screen to make sure I can book appointments quickly and easily. Again, navigate back and forth through the different modules really quickly. So one of our clients who use PS Suite, one of the first things they'll mention is how easy it is to use and how easy it is to adapt to your clinic. So I'm going to kind of highlight some of the tools or kind of showcase how easy it is using the appointment schedule. So if I open up my point, I'll make it full screen, we can all see it. As I said, everything is a click away. So right now I'm looking at a daily view for one particular provider. I can switch to a week view with a mouse click, or I can also use my action bar to make sure I can navigate through this window with a simple keyboard shortcut. So M for month and enter, take me to the month view. W, enter for week view. D, enter for day view. PS Suite always has, again, quick keyboard shortcuts that allow you to navigate back and forth really quickly. Same thing with jumping ahead or backwards. You want to have a 6-month follow-up with one of your patients, put 6M and enter, and I'm 6 months ahead to book that follow-up appointment in February. So this is kind of indicative of how easy it is to navigate through PS Suite. Everything's always, again, keyboard shortcut, mouse click, and part of your training process for implementation is find out what the best workflow is for you and how you utilize the system, how you utilize your tools or mouse or keyboard. So again, we're kind of walking you through the best way to navigate the system for you. Let me go back to my week view for a second. So in terms of our appointment schedule, we can have things like background colors. We can have things like non-bookable time. We can have different colors for appointment types. I mean, my counseling will be this purple color or pink. My consults would be pink. My follow-ups would be blue. This is all customized by the clinic. Same thing with the icons. We can always customize the icons for what you want to have inside of your clinic. So I'm going to go ahead and quickly book an appointment just to show you how kind of seamless it can be. I'm going to book one for Alison Armstrong, so I'll use my keyboard to type their name in. And here's, again, part of that customization we'll do with you throughout implementation. It's finding the different types of appointment types you have, where I can change the background color, can change the length of time. If it is a virtual visit, I can turn the virtual visit checkbox. That's going to, again, indicate this will be conducted virtually. I'll leave that one in clinic. It's Botox, hard to do virtually. And I can press my OK key. So again, part of that customization process of the month view or the week view, the different appointment types, something that is controlled by you and your site. One last thing I want to point out before I go into the records window is one of my favorite tools, which will allow you to find the next opening. Now, we spend a lot of time configuring the system for you and customizing and setting up your preferences. So one of the benefits is I can actually search for appointment times with this particular color. So if I'm looking for a new patient intake, I can look for that blue color, which again indicates Thursday afternoons I'm seeing new patients. I can say what time they can come in. I can look for the length of time that they need for this particular appointment type. Maybe you do diabetic visits only on a couple days of the week, you need half an hour for them. You can always customize this find next opening throughout your appointment schedule, which really reduces the amount of time you're spending not scrolling through the system looking for the next open time slot. That's kind of one example of an efficiency you have with the schedule window as well with PS Suite. Okay, so enough about the overview. I do want to get to Teresa's fake visit in a second, so I'm just going to spend a little bit of time showing you the record window on PS Suite. So to get into Alison's record, I'm going to right-click, and you'll see our statuses here as well. So again, if you want to have different icons for canceled or injections or prescription renewals, all customized by you. The very bottom there is that view her records. So to quickly jump from the appointment schedule into the records, again, is one click away. The same idea will make this full screen for us. So here is the PS Suite chart. So I think of it as kind of three different areas. We have the demographic window, including a picture of the patient, next time she's booked. If I see anything that I need to modify, I can double click on that to make the modifications right from this window as well. This area over here is our patient profile. So we have our family history, our problems, current meds, allergies, what you would call a CPP. That will always be visible for you to see the patient as well. This again can be moved up and down different locations. Typically, nice on the left-hand side, takes up less screen real estate. You can still see the majority of your screen reserved for the progress notes and the entries into the record. So this portion, let me just kind of summarize what the benefits are for the white space. When I open the chart for Alison Armstrong, I see all of the most recent entries. So I can see the current status. So it's a really holistic overview of what the current kind of status for this patient is. She had a PHQ-9 done. She had a CAT of her back pain done. She had a picture of her hands for her rheumatoid arthritis in the record as well. So as soon as you open it, if you're in a multidisciplinary site, if you have a nurse working with you, you see all of the current, again, most recent progress notes, most recent entries. So you kind of get a good indication of the current issues the minute you open the record. I can scroll up to see more. I can scroll down to see less. So some of my favorite tools, again, table of contents lets me navigate through to see different areas and hop around. When I see that they have an EMG done, click on that, it'll take me right to that EMG. We also have built-in filters. So if you want to see only the lab work, I can click on only labs, and that, again, that table of contents will summarize just to show you the labs. Same thing with the images, same thing with the tests. Again, you'll notice that these are all filtering according to what you're looking for inside the record. So when you open the chart, you see everything. Again, give you a good glimpse of the current status. You can always customize with different filters. And again, if you're looking for a particular issue, she has rheumatoid in her hands, I can look up the word hands and see all the different instances where I mentioned hands. So I see a bunch of pictures, I see an x-ray, all the way into the word hand. So again, it's a good overview of kind of the record. The 3 different sections, those are all, again, your basic view of PS Suite records. Now, this last portion, yes.
All right, we had a question come in, and I would like it if you could just confirm for us.
Yeah.
Could we use the Alt-Tab to switch between all windows within PS Suite?
Yes, you can. Yeah.
Okay, and then on the Mac, it's the Clover tab for Mac?
Yeah, so it's still Command Tab to switch through the screens as well. The other thing is with your Windows desktop or with your Windows keyboard, if you go to Windows, all of the windows collapse in the same icon as well. If you hover over the icon, you can see all your windows kind of pop up at the bottom. So there's different tools with your keyboard shortcut. Again, Alt-Tab does work, as you can see, and that's, again, different tools for Windows as well with the collapsing docks. Same thing with again, if you're a Mac user, you can still use your mission control to find all the tabs that are open. Great question. Yes. In terms of the Mac versus PC differences, again, it will look the exact same except for the classic Mac closing tabs, the icons up here, and then your control versus your command. So we do work on Mac and PC. It can be mixed in both in clinics as well. So some users can use Mac, some can use PC with no issues. Are there any other questions I need to address before we continue, Teresa?
Yes, there's one more that's come in. Can you email the patient directly from their profile?
So I will come back to that. Quick answer is yes. We do have an email button. I am going to talk about some of the different tools we have that are a little more powerful than an email. So again, you'll see me send patient-provider communications. I'll talk about that in a little bit longer with Teresa as my dummy patient. So the answer is yes, you can. We probably want to talk to you in your clinic about what your needs are to find out the best solution for you, whether it's simple email or using a more advanced tool like Ocean that I'll be going through in a second. Hello, is that for now?
That's it for now. I think
all
we'll
right.
hold the other questions.
Again, they're great questions. Keep them coming, and Teresa's happy to interrupt me as we go to make sure you get this addressed timely. All right, the last piece before we get on to the dummy encounter is going to be these toolbars. So these toolbars, again, are customized for your clinic. It gives you your most frequently used tools at your fingertips. So it can be a user-based, role-based, it can be a specific type of problem-based. So maybe this patient is diabetic, and I want to have the diabetic toolbar pop up for this patient now that she has diabetes. So these, again, can be created by you, customized by you, installed by you, just to make it even more applicable to your clinic. All right, so overview's over. I'm just going to go back and, again, walk through the first kind of tool we're going to be using. So Teresa does have a visit coming up today on my schedule, and I'm going to utilize the EMR virtual visit solution to see her remotely outside of my clinic. So going back to our main point of what our goal is in TELUS, we want to make sure it's integrated directly into your schedule and your current workflows. So you saw me schedule Alison with a simple click to be virtual. We're also how to launch a tool from the provider side from your EMR. In terms of technology requirements, we wanted to make sure there's no different no registration, no different applications to install. The only requirements the patient has, mobile device with a camera and speaker, which most smartphones do, or a computer with a camera, microphone, and as long as they have internet access. So we're trying to make sure that every patient can engage in this new technology to make sure they continue to get virtual visit care or virtual care throughout the pandemic and beyond. We recognize a lot of you have multiple provider encounters. So if you want to have a husband and wife, or you want to have an elderly parent be accompanied by their children, we actually support multiple patients as well. So here is Teresa. Again, we have the virtual visit has been sent to her. That's what this icon means. And what happens is when I use this checkbox, the virtual visit checkbox, PS Suite will automatically send the patient to their email address the secure link to a virtual visit. I'm just going to pull it up to show you what it will look like for the patient. Here it is right here. So they'll get a no reply email, a date and time of a reminder. They'll get instructions. They'll get a test your connection, which allows them to test their technology. We actually even have a 1-855 number to let them to call TELUS directly for assistance. So you want to ensure that we are doing the troubleshooting for tech or IT issues rather than you as the provider, you as a clinic. We want to support the patients to connect through the service to you. So Teresa needs to receive this email, press attend your virtual visit button, and she will be right into the encounter. So again, no application, no registration process. We really want to make this as foolproof as possible for the patients to join. So in terms of the provider, again, EMR or EMR Mobile, it's always one click away from your schedule. I'm going to show you the provider view. Just going to minimize this for a second. Go back to my schedule. Here's Teresa. I can right click, start my virtual visit from here, and it'll open up into what we call our technology window, see my microphone, see my camera. I can press join, and here's Teresa there on the other side waiting for me. So this is kind of what you look like when you have your patient virtual visit. I even have a little chat feature I have here. I can say, send her links, send her different phone numbers to call. We're going to upload pictures through this chat as well. So if Teresa has a rash she wants to upload from her phone, she can send it directly through the chat feature to me, or I can import it into my EMR. So the patient has an opportunity again to send you some text back. So in this case, her son's in the room. She's trying to be able to talk as freely to you as you might want. So you might need to, again, be conscious of that as you're doing some assessments with her. So in terms of how people typically will chart, we have Teresa on the right-hand side. I'm going to open up her record. I'm going to show you how we go side by side. Sorry, where to go? In the other window. So here is, oops, one second, let me pull this up for a second. There it is. So here's Teresa's record. And again, we can always go to the split screen view where I have her encounter here, and I have her picture over here and her chart over here. I can quickly make her notes. I can quickly see her patient profile, see her demographics, see if she needs to do any updates from here. After you're completed the visit, I'm going to leave her to go full screen in a second, but I have a simple hang up button that I can terminate the visit with Teresa at that point. This is kind of how we would typically see our clients use our virtual visit solution: is chart on the left, patient on the right or vice versa. She can see both screens at one time. All right, so I'm going to end the visit with Teresa. I'm going to hang up on her after we've completed that note. And I'm going to go back to a full screen. And I'm going to show you, again, the first tool that I want to talk about for patient-provider communication. So you've kind of touched on it a little bit in terms of how we can email from the record, but I want to, again, expand upon that. So we have a lot of tools that allow you to complete e-forms, capture consent from your patients, offer online booking, send documentation using some of our add-on services. So I'm going to show you one tool that allows me to send a PHQ-9 form. Again, you can complete it or someone in the room and actually send her a secure message directly from the EMR. So provider to patient, again, I can't give Teresa a handout or a note or have her complete a questionnaire if she's not in the room with me. So that's what some of our add-on services allow you to do for virtual care. So I'm going to directly from her record, I'm going to press the email button and it will open up. I'll just make this full screen again, and I can customize this message as well. So she'll get an email directly, or she'll get an email to her email on file. I can send her a secure message. Please call the office to arrange for a pap smear. And I can even or attach an e-form to her for her to complete at home. Again, that PHQ-9 form, I'm going to have her complete it because we couldn't do it together in the office. I'm going to press that send button. So that is sent successfully through one of our EMR add-ons to Teresa's email. And what she'll get is she'll get a message from your clinic prompting her to view the secure message and complete a questionnaire. So when I turn this on, it prompts the patient for their birthday. You can optionally ask them to enter in their health card number for more security if you want. And I can see that secure message from my healthcare provider. And I can actually even confirm that I've read this message. That's going to go back into your EMR so that the provider knows they've actually seen this message. So you do know if they have received it successfully. And here's that PHQ-9 form that I wanted her to complete because her son was in the room and she couldn't do it over the virtual visit. Give me a second. Click on a couple of these. And I'm going to press my finish button. So automatically, Teresa gets an email, she gets a secure message, she completes the PHQ-9 form, and what happens then is automatically we've uploaded her record or that documentation to PS Suite. So at 2:33 I sent her a message, she saw it at 2:34, and she completed that PHQ-9 form to the score of 14, automatically uploaded to her chart. So all of this is done, again, through one of those EMR add-ons to increase communication with your patients over virtual visits. Okay. Now the next one I'm going to talk about will be how to communicate with pharmacies using our EMR solutions. So I'm going to just quickly go through one of our templates to show you how our charting works or how our templates can increase your efficiency. So the quick visit we had with Teresa, the last virtual visit, was maybe she had a cough we wanted to explore. This is an example of one of our templates that allow you to automate your notes. So I'm navigating by clicking through these, or I can press my N on my keyboard, my Y on my keyboard to get that to document her symptoms. So I can skip a couple. I'm not going to go through all of these. You know, the ones I do not enter on are not included in my notes. I can say if she has a history of asthma. I can say that there's yes allergies. And if I scroll down a little bit, I want to point out that a lot of our templates, again, do have some clinical decision-making tools in them. So if I click on asthma, I get my asthma treatments popping up automatically. Whereas if I click on my pneumonia treatments, I get my pneumonia treatments coming up as well. So how you interact with our forms or templates in PS Suite will have a kind of a navigation or a guidance of what you could be prescribing, what you could be looking for, what you could be asking about for this particular assessment. So I'm going to click on asthma, I'm going to click on salbutamol, I'm going to order a CBC as well. I'm going to do my billing from here. Let's say that it's symptomatic relief and she needs to return if it worsens or fever develops. So we have a whole library of these templates, again, free of charge. You can customize these for your clinic. We give you kind of the library to choose from, and then from there, you can customize, build your own, and modify them for your workflow. So when I press finish, I'm going to have my bill book pop up. So here's that bill book pop up for subunit or for asthma, with asthma and A007 clicked off. I'm going to have my subunit already started for my prescription. I'm going to have this wait for a second. Here is my CBC rec coming through. So I ordered a CBC that's already filled out for me with Teresa's name on it and my provider details. I'm going to have my encounter note already done based on the template and the symptoms that I've selected. So we kind of give you one tool that does a lot of different things inside of the EMR. So let's go back to PrescribeIT for a second. We talked about provider-patient communications. That's what we saw with the PHQ-9 and the secure messaging. Talk about provider-pharmacy communications now. So PrescribeIT is the national service that all of our clients have access to as a complimentary service. Again, it allows you to send prescriptions directly from your EMR, bypassing the fax, and again, not changing your workflows. So that's kind of our big goal. Make sure to use these add-on services without changing your workflow. So it's not just electronic prescribing. It will allow you the pharmacist to send you e-renewals, allow you to send the pharmacist send you communication messages back, and it will allow them to send you dispense notifications. So if your patient fills their medication at the pharmacy, we alert you through PrescribeIT it actually has been dispensed. So you know if they're actually picking up their medications as you prescribed. So electronic prescribing has a little more power than just bypassing the fax machine. So I'm just going to walk you through. I'm going to complete that other one that I showed before. So here's my subunit. I'm just going to quickly finish this prescription using a prescription favorite. We can see that if we want to fax the prescription, it's one button. If I choose PrescribeIT pharmacy with someone who's enrolled in PrescribeIT, we have the e-sign and send option as well. So that's going to allow you to submit the prescription through the PrescribeIT interface. It will also send across their demographic details, also send across her allergies, also send across her current vitals. So if it's a weight-based dosage, we send across her weight as well to the pharmacy. If I had any interaction warnings, so if subunit had a drug interaction with one of our problems, one of our other medications, that's also sent along to the pharmacist as well to know that we are aware of the interaction to subunit. So all that happens kind of behind the scenes. And the only difference for the provider is to press the print button or press the fax button. Fax or e-sign and send for PrescribeIT versus a regular pharmacy. So I'm just going to post this to the record. And that, again, automatically updates your current medications, sends it to the pharmacy, including all of that other discrete data that is helpful for the pharmacist and helpful for medication safety as well. So again, PrescribeIT is complimentary for all of our clients. We already have more than 2,000 nationally subscribed to PrescribeIT. And again, you'll see that it's another instance of us not changing workflows, but incorporating more tools into your current existing workflows. All right, the last one that I'm going to point out is the provider-to-provider communications. This is how you want to communicate and engage with your other healthcare providers in the wider circle of care. Electronic messaging, again, a lot more than just electronic messaging bypassing the fax machine. We are sending discrete data across using MedDialog. So things like Teresa's demographics are also being included in this message. So that means for the receiver is that rather than add Teresa's information manually, they can press an add patient button. It will automatically create the record for them to save them some time as well. More and more of our data being sent through MedDialog is becoming discrete data, and that means that, again, it'll import directly into their EMR, just like you entered it in your EMR. So MedDialog, again, it does save you a lot of time communicating. It's the exact same workflow as an internal message. So if you want to send a message to a prescriber across the city, use the same workflow that you send a message to somebody who's inside your clinic, such as your receptionist or administrator. So same workflows, more powerful tools. Again, we already have a lot of our providers subscribe to MedDialog. Our network is growing who you can communicate with a simple message. Let me show you how to send a letter through MedDialog and what the differences are. So I want to send Teresa to a specialist. I can look up their information from my local address book, and I also have a whole other address book that is kind of wider than my specific clinic, or my specific local address book. I'm going to send to Charlie, who's a MedDialog provider, and this workflow does not modify, no matter regardless of how I'm sending it. So if I want to send a referral letter regarding her cough and potential asthma, pulls in the medications, pulls in the allergies, pulls in the meds directly from the patient profile, again, to reduce my double entry. So MedDialog or fax, we have this highlighted as both services because we don't care how the receiver is going to receive or how the receiver is going to get this message or get this fax, because the workflow does not change for the sender. So if I click on this button and I want to press send now, that's going to again look to see if Charlie Doctor is going to is a MedDialog prescriber or MedDialog subscriber, or if she is not a MedDialog subscriber. So it's a bundled service. That means that if I can't send it by MedDialog, I send it by the fax automatically. There's no kind of choice for the provider of how to send it. We do all of that background work for you just by pressing send, delivers through fax, or delivers through MedDialog. Again, no change to workflows. You just get to press your send now button and off it goes, however we can deliver it. Same thing, we're sending over demographics. We're sending over all of the warn where to treat data being sent across, so they can simply press that add button to make Teresa a new patient in their EMR. All right. We are connecting, so MedDialog, again, bundled service for faxing and for MedDialog providers. We are working to expand that network to include other secure messaging networks together as well. So right now, if they're on MedDialog, they receive it a MedDialog message. If they're on a fax, they receive it by fax. If they're on other communication tools, we're also incorporating MedDialog with those communication tools as well. So I'm going to pause there for a second before I go back to Teresa. I did promise you to show you this workflow from the EMR Mobile as well. So EMR Mobile is it's an app on the App Store, the Google Play Store, that allows you to see your EMR from your mobile device. So I'm just going to open up what it looks like from my screen here. So if I open up this window, this is what your computer or your tablet or your phone will look like to access the mobile app. So you'll see that we have your schedule. I can start the virtual visit directly from my schedule. Again, think of this being on your iPhone or your Android phone. I can see Teresa's record, and I can see maybe the psychology note I did. I can see that letter I just made to that doctor that we just wrote together. I can see her medical summary, which means I can see her problem, see her meds, see her allergies. I can add a specific note to the record. I can add a message to my my administrator, and I can even send a prescription or write a prescription and right from my cell phone. One thing I can't show you through this view is I can take a picture of Teresa with my phone that will automatically upload to the record as well. So helpful when you go back to in-person visits and they have a rash on their arm you want to document, take out your cell phone, open the mobile app, press the take a picture button, it will automatically upload back into Teresa's chart. So other kind of functionality, we can see records, we can see demographics, we can see calendars, we can see look up address books as well, and we can see our inbox for our labs that we've received we haven't looked at yet, and our non-lab messages. So we're connected, again, right to our EMR from our mobile device or tablet, so you can see all of the tasks and our patient records kind of right from our pockets. So at this point at 10:46 or 2:46, I'm going to give Teresa some time. So I hope I've kind of shown you some of the tools for connecting providers and patients, providers and pharmacists, providers and other providers directly from your EMR, and how it can all be done through the mobile app as well. So again, if there are more questions, keep them coming through the chat. I know I can't show you the whole EMR right now. I want to give you a little overview. But I'm going to send it over to Teresa to walk you through what the implementation process looks like to onboard into PS Suite.
Allison, thanks for that. However, I'm just going to flip it back to you. I think there's a question that's relevant to the topic that you just discussed that perhaps can be addressed now before we move on to implementation. Is there anything you can't do in the mobile version, or is it identical to the desktop version, just optimized for Android or iPhone?
So our goal is to give you a full-fledged EMR in your pocket. So right now we can add appointments. We can look at appointments, obviously. We can add notes. We can add prescriptions, see messages, document labs. We can do more functionality. So again, our adding a picture from your phone, that's kind of a tool that's reserved for a mobile app only. But we are, again, building out more features. So not everything's going to be there at this point, but we are trying to make it a full-fledged PS Suite kind of on your phone. So things like adding, accessing handouts you can't do from mobile app. You can't, again, there's specific things you might not be able to do yet, but we are slowly developing that app, quickly developing the app to become a full-fledged EMR. So the follow-up question is, could they completely chart from a phone tablet? I'll show you what that would look like. So the phone or tablet view, let me open this up again. So if I want to write a note on Teresa's chart, I would open up her record, and if I press this plus sign, there's that add a note right here where I can simply type on my phone and add that note directly to the EMR or directly to her record. So some of the text options you can, again, customize or stylize this note, but as soon as you press your done key, that's going to go kind of into both records, as you say. So it is, again, a living record that's the exact same as this chart. So there's when it's entered in the PS Suite view. Let's pull up the chart again. So yes, they can. They just might not have all the tools, like that template I used before. They might not have that ability in the mobile app, but they can definitely chart on both features or both kind of different views. You're welcome. Is there any other question I need to answer before we throw it back to you, Teresa?
I don't see another question at this time, so maybe this is a good time to move on to our next part of our presentation. So I'm going to spend a couple of minutes talking about our implementation process so that you are familiar with the steps should you choose to become a PS Suite EMR user. So we start off with receiving an order, and once it's received by our implementation team, we'll start the process by reviewing the details of the order through the intake point. And we'll scope and evaluate all the details that were discussed at the time of the sale. We'll assign a project to one of our project managers who will reach out to you as they'll be your point of contact. They will begin the project kickoff process and assemble the TELUS EMR team who will walk you through the implementation. So along with the PM, the project team will consist of a learning specialist, a clinical analyst, data analyst, and our professional service engineers who are the server configuration experts for your implementation. And all of these team members will work with you through the implementation from the start and through to go live. Of course, there are opportunities where we will adjust the project needs based on the particular circumstance of your clinic. And for example, if you have a paper-based system today versus the fully electronic data migration requirement. We'll arrange for a clinic needs assessment with one of our learning specialists to work with you and your team to understand the unique workflows of your practice, to guide the development of your customized learning program. Our data team will evaluate the data size and mapping requirements to align with the migration activities. and you and your team will be supported with opportunities to review the clinical data in the test environment prior to a live migration. Throughout the entire implementation process, we'll focus on the EMR delivery with minimal downtime to ensure you're able to see and take care of your patients as quickly as possible. We'll be there to help and support you in the first few days of post-go live to make sure that your team members are feeling successful in the clinic workflows and, of course, removing those first day jitters of using a brand new system in practice. As you see the system in the first few weeks of go live, your PM will continue to be your point of contact. They'll help you transition to the next level of client support when you need it. They'll introduce you to the processes of connecting with their client experience organization, and your implementation, of course, will be complete at that point as you'll successfully utilize PS Suite EMR within your practice, and your team will be there to support you as well. Those are all of the steps as part of our implementation process. So if you should have any questions, please feel free to use the chat or the Q&A function, or we can address those questions live at the end of our discussion. So maybe we can move on to the next slide, Alison.
Yeah.
All right, our satisfaction survey. Before we end the call, we want to remind you that we'd like you to kindly fill out a short satisfaction survey, which will appear when the WebEx is ended. We enjoy reading your responses and discovering new ways to improve our presentation. Plus, by doing so today, you'll be automatically entered into a draw to win a $300 Amazon gift card. The webinar, once the webinar is closing, we hope that you find the information valuable in this discussion and presentation. Yeah, I think we can move on to our questions. Accessing the survey, actually, we'll just take a moment here to review this. There will be a window that will look very similar to this. There will be a continue tab to take you through to the questions, or you can use the QR code on your phone to pick up that, or you can use the URL that's displayed there to access the survey. Okay. All right, Mike, I think we can trigger the live questions.
Of course. So just to remind everyone to ask a question, please press 01 on your keypads. And we'll just give everyone a few moments to queue up again. To ask a question, please press 01 now.
So in the meantime, I saw there was a question that came through about currently being on paper and whether they could begin scanning charts to onboard to PS once they have access. So if you are coming from paper, again, that reduces the need for the data migration piece. So part of the implementation process will be discussing with you the ideal or some of the workflows you can adopt and some strategies we have to reduce that paper to EMR burden. So yes, we can always kind of, as you're becoming, as you're onboarding throughout your whole project, we'll kind of set you up with kind of a strategy. What format's best is definitely looking for PDF. Whether you scan the pertinent documents, all the documents, that's something you can kind of prepare for with your scanning tool. Again, we'll walk you through that as well. So you can definitely start. One thing that would be a little bit more difficult to kind of prepare and get ready for is the patient profile, if you have one. That would obviously need to wait for you to get access to PS Suite to start making that patient profile with the medications and the family history. I want to make sure we don't scan that. Let's get that into PS Suite and then the proper PS Suite format with that patient profile. So great question. Currently paper, yes, it might be a lot of scanning, but again, we do give you some strategies as we move forward to how to best accomplish that for your clinic. Are there any questions on the phone coming through?
Yes, we did have Jax queuing up, but you have to remember once you have your name taken, please press 01 again to get back in the queue. So I guess, Jax, if you're listening, yes, there we go. So first question comes from Jax. Please go ahead.
Hi, thank you for the presentation and your answers. Fantastic. I'm looking to find out if multiple users can access the same chart simultaneously. So, for example, one admin and one doctor at the same time, and if so, does it slow anything down? Does it lock one of them out from changing? How would that work?
Yeah, so everybody can access the record at once. So if you have a nurse and a doctor, everyone can look and kind of modify and filter the record. But the stipulation is only one person can be changing it at one time. So again, as the doctor is making his or her notes, the other people are kind of locked out. They can still view and change and print, but they just can't actively edit a note at that same time. So you have to have like a 10 seconds kind of waiting period. So as soon as I stop typing for 10 seconds, then it's kind of back into the queue so everyone else can access it at the same time. So everybody can look at the same time. This one person at that particular second can be making modifications.
Perfect.
Or else they have to wait 10 seconds, yeah. Great question. And that's kind of a common workflow. Somebody takes vitals, leaves, the next person kind of logs in, looks at the same record, and starts their encounter notes. Thank you for your question.
All right. Next question comes from Zareen Saeed. Please go ahead.
Hello. So we are a solo practitioner, and we are looking to transition to a more EMR that's something like yours, where we have virtual care integration and a lot more features. So do you have different modules available that can tailor to our needs? Because we are not a group practice. We are more of a solo practitioner. And also transferring and porting all the data from our existing one to the new one.
Yeah, so I'm going to let Teresa speak to the transferring data. I'll take kind of the first portion. So we have a number of different clinic types, whether you're solo and you're a fee-for-service, whether you're part of a bigger group and you have a community health center, kind of a community health-based practice. We have all of those different types of practices. One of the first things you'll do is you'll go through kind of an in-depth conversation with somebody from Teresa's team. They'll highlight what your needs are for your clinic. So you kind of saw we can customize the EMR for the type of practice you are. And again, we kind of work with you to make sure that you are set up in a way that supports you. So even if you're small, that's again, we have plenty of solo docs on PS Suite. So we'd definitely be able to accommodate that smaller clinic. In terms of
so how does this start? Okay. So do we set up an appointment, you come into the office, or do you just wire, we can chat over the phone or via Zoom?
So I'm definitely happy to follow up with you afterwards. I'm going to let Teresa speak to the data migration portion, because I know that's one of the most common questions we get for people coming to PS Suite is what happens to their data. So Teresa, do you want to have just a quick?
Sure. So we've had a team that has a lot of experience with bringing data from various third-party vendors through to TELUS PS Suite EMR. Our data team, it works as a team, and so we've got our clinical analyst who's there to help support our data migration team members in understanding where data needs to map to coming from whatever system you might have. So there's an export component that you would be getting from your current vendor. We take that file and review the data to see the first level of migration activity that we can do. There's what's referred to as a UAT environment, user acceptance testing, where we do some mapping. We then bring in yourself, your team, with our clinical analysts to review how the data will look following the live migration. So it's really a test to make sure that you're comfortable, you understand where you expect prescriptions to be, how they look, etc. If there's any, areas that need to be customized, that can be discussed at the time. And then we take you through to the live migration, and your hand will be held, I guess, after that live migration with one of our learning specialists, just to make sure that you're comfortable with that first day system in your practice. Does that answer your question, or are there more specific details around the data migration piece that you're curious about?
Yes, thank you.
Okay, great. Thanks.
We do have a subsequent question from Jax.
Okay.
Do we have time?
Yeah, I think we can answer one more question.
Sure. Go ahead, Jax.
So for documents that we onboard, do we have the ability to split them natively within PSS? So what I mean is, if we get a fax from a hospital that's got like 5 patients in it, can we split that fax up into each individual patient, or do we have to do that separately from PSS and then onboard them?
I'm going to turn it over to Alison to answer that question.
Typically, again, a lot of it depends on your incoming fax solution. So you would, again, if you have kind of a supported scanner, we would kind of supply you with a PDF kind of rotation tool. So sometimes when you take off a cover page from a doctor or from a different pharmacy or a different provider, so there will be kind of some training on document manipulation using one of the PDF editors. So that is part of the training process, how to kind of prepare your faxes for import to PS Suite. But again, it does rely on an external PDF editor, but you can kind of access it from within the program. So splitting and rotating you can do from the interface, but again, it will open up in a different window, which will be your PDF editor, where you'll do kind of the work. It will automatically come back into PS Suite as the correct kind of look. So while you can start it, we do rely on Adobe or Nuance or a different solution to split those or to take off cover pages.
Okay, thank you very much.
I think we're now at 3:04, so we would like to thank everyone for participating in today's webinar. If you should have any questions, we have an email address listed on the slide at telussales.emrs@telus.com that you can use to send your questions to. We want to wish you a very nice afternoon today, and also make sure to check out our upcoming webinars on the registration page. Have a great afternoon, everyone.
Bye, everybody.
Bye-bye.